With ongoing overcrowding issues in ERs across Quebec, one doctor is sounding the alarm, taking to Twitter to describe his experience of having a patient die in front of him after he waited 16 hours in emergency. We're joined by Dr. Sébastien Marin, an ER doctor at the Barrie Memorial Hospital in Ormstown. Thank you so much for joining us.
Hi.
Can you start by telling us what happened to this man, this specific case?
Well, the patient came to the hospital with back pain. He presented at a hospital. He was triaged. There was a very, very long wait, a lot of people. So they sent to the wait room. The patient waited for multiple hours. And at the end of the evening, I was tired. So decided to go home to try to have a bit of sleep. The patient didn't sleep all night. He came to my emergency early in the morning. Our triage nurse triaged the patient, put the patient in the room, and I saw the patient immediately. I was worried about a aortic dissection, which is when the aorta starts splitting open. Started preparing for tests, and suddenly the patient collapsed and died in front of me.
How do you feel as a doctor to be in a situation like that where you could help someone, but because of the way that our current system is very strange, you couldn't?
Well, it's always frustrating to have a patient come alive and die under your care. But it's even more frustrating when you know the patient did the right thing, went to the hospital, and just didn't receive timely treatment for his condition.
Do you feel that if he would have seen a doctor sooner, that he would have had a chance?
He certainly would have had a chance. We can never guarantee that a patient will survive anything. However, there's treatments for what he had. We can slow down the dissection. The patient gets some surgery, some stents. There's treatments for the pathology he died from.
If we look at the ERs right now across the province, I mean, it's bursting at the seams. Do you fear that something like this could happen again? Are patients at risk?
Patients are certainly at risk. I never named which hospital the patient went to because it's not a specific hospital problem. There's 5, 6, 7 hospitals in the greater Montreal area that are living with the same problematic that hospital has. There's hospitals in other regions also that have the same problematic where patients are just waiting too long. It was a problem waiting to happen. And a lot of my colleagues, which I spoke to, said that they've been speaking up about this for months and months and nothing's changing. So that's the reason why I came out with a case of a death. I think it was important to speak up.
Dr. Marin, thank you so much for your time today.